Hi, I'm Dr. Bardia Anvar from Skilled Physicians Group and Skilled Wound Care. Hematomas are larger formations of blood within or underneath the actual skin itself. Usually they occur because blood vessels may rupture from injury to the body site and then with the result of a hematoma forming in that area. So it's basically a pool or collection of blood underneath the skin. What do I recommend doing within the first 24 to 48 hours of a hematoma? Apply ice or cold compression to the area to limit the swelling and also to limit the bleeding that may still be oozing underneath the skin. Cold will usually constrict blood vessels and stop them from continuing to have blood come out of them. After the first 48 hours, that's when we switch over to recommending more warm compresses, which will actually cause the blood to, underneath the skin to actually loosen, soften up, and then be reabsorbed into the body. We only want to use the heat for about 15 to 20 minutes at a time, 3 times a day. And we only want to use the cold compresses maybe 2 or 3 times a day for a maximum of about 30 minutes. And these can also be painful, so speak to your physicians, or if you are a physician, make sure your patients are getting adequate pain control for these. For the physicians out there that are looking to see what to do with hematomas after the first 48 hours to a week, and they may look suspicious for infection, they may be getting larger or may have unusual discoloration over them, then that is when we do what is called a hematoma evacuation. And we actually evacuate the blood out of the hematoma. And we basically make an incision. We take all the blood out and see where the source is, if there is continued bleeding, and we try to get control of that bleeding itself. If it's a major hematoma, usually that's done in the operating room. If it's pretty minor and it's been there for a long time, we believe it's infected and we already are seeing purulent drainage coming out of it, we can open it at bedside. But make sure you have confidence in your skill set before managing an infected hematoma, of course, and be very careful because you can run into serious bleeding with a hematoma, and then treat the infection as appropriate. If you are a physician and you are interested in new practice opportunities or entering a new field like wound care, we would be happy to talk to you about what are all the opportunities available in the wound care field for you. It is a career transition. We do know that many people are interested in lifestyle and the opportunities it brings, and we would be happy to talk to you about it.